हेलो फ्रेंड्स। आज हम बात करेंगे वाई पर्सन हैज़ टू टेक EECP ट्रीटमेंट, that is US FDA approved natural bypass treatment to treat heart disease, heart blockages, to treat angina, severe chest pain, to treat congestive heart failure, to treat chronic fatigue syndrome, to treat post-COVID effects, to treat restless leg syndrome, to treat vascular disease. So why person should take EECP? Once Dr. Abdul Kalam has said in 2005 in the Interventional Cardiology Conference at Mumbai that 70s was era of bypass surgery, 80s and 90s was era of stenting and angioplasty, but in 20s and 21, new venture, new science, new development in treating cardiovascular disease in the name of EECP, enhanced external counterpulsation, has emerged, and that is far superior, non-invasive, no surgical treatment. So why it is superior and to be taken? So first, the mechanism of EECP is to develop collateralization. What is happening when you have chest pain while walking? That means you have blockage in the artery more than 70%. If you have chest pain with perspiration or another GI tract symptoms like vomiting, nausea, impending doom, dizziness, dyspnea, then it can be said that your minor blockage less than 50% or rarely major blockage can rupture due to hypertension or shear stress or diabetes rise or infection, and it can lead to clotting cascade and platelet aggregation. Normally what happens when you go to hospital with complaint of chest pain, either it may be acute heart events, or either it may be acute acidity, or it may be esophageal spasm, or it may be sternal costochondritis pain, or it may be due to vitamin B12 D3 deficiency. Immediately after giving preliminary treatment like tablet Disprin should be chewed, 4 clopidogrel 75 milligram should be taken, 1 atorvastatin 80 milligram should be taken or given at any healthcare center. Then immediately to control blood pressure by antihypertensive with 120/80, and if blood pressure is low, then you can put patient on a IV fluid or inotropic support. But normally in hospital, in any condition, either high BP or low BP, in spite of giving anticoagulant, antithrombotic, antiplatelets, they immediately do angiography and angioplasty. They show blockages 80%, 90%. That is not exactly shown by the machine. It is a mind of doctor, it is a mind of cardiologist. They cannot differentiate in a percentage. So patient has a lot of fear, relatives have a lot of fear, and they compulsively go for surgical intervention or stenting. But when you put patient on intensive medical treatment, there are a lot of trials like ischemia trials, CARET trials, steroid trials, that intensive medical treatment is equivalent to invasive treatment. And EECP, instead of bypass and stent, why it is superior? So EECP treat whole heart, improve oxygenated blood to the whole heart. And EECP works as per cardiac cycle. When heart is in relax, there are cups tied on the leg, three parts of the leg uh, inflate and put retrograde pressure on the aorta and diastolic augmentation occur. And when heart is in contract, the cups from upper to lower side automatically relax. And that is due to electrodes like ECG are applied to the chest, that is with EECP machine. So EECP computer and EECP compressor is indirectly connected with ECG. So when heart is in relaxation, pressure comes, heart is contracting, pressure release. Such one hour milking process augments multiple collateralization around block vessels and dilate all the vessels. Block vessel also dilates and open the dormant vessels, develop vascular growth factors, different types, develop stem cells, reduce inflammation, reduce inflammatory markers, and the main effect is it improves the left ventricular ejection fraction, means pumping. When heart attack occurs, within 3 hours, heart muscle damage and scarring form within weeks. So that part will not contract. So when you do a angioplasty or angio bypass surgery after 6 or 12 hours after heart events, it is not at all useful. That American Heart Association and Harvard University says it is not useful. It is just palliative treatment. It does not prevent heart attack or death. Angioplasty or bypass does not prevent heart attack or death. So EECP cross the scarring muscle and develop capillaries in that, and develop capillaries surrounding the block arteries and make block arteries rudimentary, means niskriya. So that is why in future, if your lifestyle is not good, like in stent or bypass, you have again complain after 4 or 5 years because stent blocks. So in future, if you have any major or minor complaints after taking EECP, it will not be fatal like stent or bypass, because so much collaterals has developed and heart pumping has improved. So the beauty of EECP is that future cardiac events will not be fatal. You will not find any inconvenience. And along with EECP, you have to take heart healthy diet and you have to make your body walkable and you have to quit smoke or alcohol. You have to avoid white sugar, white bread, fast food, then fast food, fried food. You have to avoid fast food and fried food. You have to avoid non-veg. That is a routine to treat heart disease. And you have to take intensive medical treatment along with EECP. And after EECP, diabetic medicines, heart medicines, renal medicine, kidney medicines, if person has kidney disease, will subside and disease will improve. So this is the beauty of EECP. And EECP, there is no cut in the body, no needle in the body. So again, if you have a mild problem, you can take another course of EECP after 5 years. It is non-surgical, no trauma to the heart. You can again rejuvenate yourself. Thank you very much.